digital assessment today. Can you please tell me your name and date of birth?
Will, June 4th, 1998,
Good. And can you tell me where we are right now?
Hawaii,
Good. And can you tell me what the month and the year is?
April 2025.
Good. I'm just going to wash my hands before we start. Do you have any questions before we begin?
No.
Okay. So the first thing I'm going to do is inspect your skin and your nails. So I'm just going to pull this down on top. Just looking at the skin color is appropriate for ethnicity. I'm not noticing any suspicious lesions on the skin. There's no redness to the skin as well. And then I'm going to be looking at your nails here. So there's no splitting or clubbing of the nails. The cap refill is brisk. It's less than 3 seconds. Again, on this hand, no clubbing or splitting of the nails. And cap refill is brisk in the nails as well. Next thing I'm going to do is inspect your face and your scalp. So again, just looking at skin of the face, the skin color is appropriate for ethnicity. There is no acne lesions or any redness and any swelling that I know. Next I'm going to be palpating your scalp. Just let me know if there's any tenderness as I palpate. Anything hurt?
No.
Okay. So the scalp, the hair is evenly distributed throughout the scalp. There's no patches of missing hair. There's no lumps that I feel with palpation and no deformities in the scalp as well. So next we're going to move on and look at facial symmetry. This is going to be testing cranial nerve number 7. So I'm going to have you give me a big smile and puff out your cheeks. Raise your eyebrows. Good. So with these movements, facial movement is symmetrical on both sides. There's no facial droop that I am noting. So cranial nerve number 7 is intact. The next cranial nerve we're going to check is number 5. So I'm going to be assessing your TMJ and your jaw. So I'm just going to place my fingers right in front of your ears, and I'm going to have you open and close. Let me know if there's any tenderness with this. I'm going to have you open, close, open again, and then move side to side. Good. There's no clicking or popping in the jaw, and he's not reporting any tenderness, and so cranial nerve number 5 is intact. So the next thing I'm going to do is be inspecting your eyes. Just first looking at the eyebrows and eyelashes. There's no patches of missing hair. The hair is evenly distributed. And then I'm going to be pulling down your eyelids just to look kind of more inside your eyes. So go ahead and open for me. And I'm just looking at the conjunctiva and the sclera. It's pink and moist, and the sclera is white. There's no yellowish in the sclera. The cornea is intact, and there's no drainage or erythema in the eyes. So next, I'm going to be checking your your pupil movement. So I'm going to get my pen light. So I'm going to turn down the lights a little bit when we do this, just so I can see the reaction of your pupil better. This is going to be testing cranial nerves number 2 and 3. So I'm just going to have you look straight forward for me. Good. So with direct and indirect light, the pupils constrict. So that's showing that cranial nerve number 2 is intact. Now I'm going to look for accommodation. So I'm going to have you look at an object past my shoulder. And then I'm going to have you look at my finger. And then look back behind me again and back to my finger. Okay, and then follow my finger. Good. So the eyes accommodate to nearby objects. The pupils converge and constrict when focusing on a closer object. So now I'm going to be assessing your pupil size. So just looking at your pupil size here. Just go ahead and look straight forward for me. The pupils are equal at about 4 millimeters each. And now we're going to be doing your pupillary response to the extraocular eye movements. This is going to be testing cranial nerves number 3, 4, and 6. So I'm just going to have you follow the tip of my pen here and just moving your eyes, not your head. nystagmus is present when the eyes are moving and the eyes are moving symmetrically together in all 6 extraocular fields of vision. So next I'm going to be using the ophthalmoscope to look at your pupils and then deeper into your fundus. So I'm going to turn the light down again here. The first thing I'm going to be looking for is for the red light reflex in your eyes. I'm just going to keep looking off into the distance. I'm going to come to this side. So I'm seeing the red light reflex in both pupils. So now I'm going to be looking at your fundus. I'm going to rest my pinky on your cheek, that way I know I'm not getting too close to you, okay? Okay, and I'm going to stand on this thing. Good. So looking deeper into the fundus, I'm looking for any hemorrhaging and I do not see any. The disc margins are sharp. There's no abnormal findings such as congenital bodies or anything like that, and the optic nerve is not swollen. So this is just taking a deep look into the eyes. So next we're going to be looking at your ears. So I'm going to switch out my scope here. First I'm going to be just looking at the external ear itself. So looking for any redness or swelling and any drainage. And does this hurt as I pull up?
No.
Good. No tenderness with palpation of the pinna. And there's no erythema present. I'm going to check the other side as well. Again, on this side there's no redness, swelling, no tenderness in the ear. So now I'm going to do a whisper test. I'm going to occlude your tragus of your ear and I'm going to whisper some words. Just let me know what you hear. Okay? I'm just going to do it on both sides. Okay?
8.
Eat.
Eat.
Cold.
Cold.
And I'm going to do the same on this side. 9.
9.
7.
7.
Food.
Food.
Good. So the whisper test, the ear hearing is intact on both sides. He was able to hear when I was occluding the tragus. So now I'm going to take a deeper look into your ears with the scope. I'm going to look at the tympanic membrane. I'm looking for the cone of light in here. Good. So on this here, the tympanic membrane is a pearly gray color. I do see the cone of light is present. There's no cerumen in the ear canals, and there's no erythema within the ear. Again, just looking at this side. Good. So again, on this side of the ear, the tympanic membrane is present. It's a pearly gray color, and the cone of light is seen on this membrane as well. There's no cerumen present in the ear canals as well. So now I'm going to be looking into your nose here. I'm just gonna first just check symmetry of the nose here. The nose is symmetrical and the nasal septum is not deviated. I'm gonna have you tilt back a little bit. Okay. The nasal terminals are visible. There's no redness or swelling that's present in the nose. So next thing I'm going to do is inspect your mouth. So I'm just looking first at your lips. The lips are not cracked and dry. There's no sores in the corners of the mouth here. I'm going to have you open for me. Just going to take a look on the inside. Okay. The oral mucosa is pink and moist as well. Teeth are all present. There's no signs of any ulcerations within the mouth. I'm gonna have you stick your tongue out for me. looking at the sides of the tongue here. No ulcerations on the sides of the tongue. And then can you move it to the side for me? Good. And then can you put your tongue up? Good. And put it down? Good. Okay. So again, no ulcerations on the tongue or underneath the tongue. The tongue is red and moist as well. So now I'm going to take a look at your hard and soft palate. So again, I'm going to have you open up. Good. And then go ahead and stick your tongue out a little bit and say ah. Good. So the uvula rise is present symmetrically. That's showing that cranial nerve number 9 and 10 are intact. And the hard and soft palates are also pink and moist. So now I'm going to have you stick out your tongue and then move it side to side. Good. So tongue protrusion is intact and that is assessing cranial nerve number 12. So now, this aside, now I'm going to be just inspecting the throat area, inspecting the thyroid. There's no signs of any goiter and the neck looks symmetrical on both sides here. So now I'm going to be doing the strengths and movements of your neck. So I would like you to flex your neck down, good, and then extend your neck backwards. And then I'm going to have you try and touch your ear to your shoulder here, and then to the other side. And then can you rotate your head for me? Good. So neck range of motion, there's full range of motion in the neck. And then I'm going to be testing for cranial nerve number 11, your trapezius muscles and the sternocleidomastoid strength. So I'm going to have you push up into my hands, shrug up, good. Okay, you can relax. And then I'm going to have you turn your head into my hand. And then on this side. Good. So with these movements, cranial nerve number 11 is intact. The shoulder strength and sternocleidomastoid strength is 5 out of 5 strengths throughout. So now I'm going to be palpating all of your neck lymph nodes. Just let me know if there's any areas of tenderness, okay? I'm going to pull this down a little bit too so I can do your clavicles. So occipital lymph nodes, postauricular, preauricular, tonsillar, submandibular, submental, the posterior cervical chain, the anterior superficial cervical chain, the anterior deep cervical chain, and then I'm going to have you kind of shrug your clavicles up like this, and the supraclavicular. So I wasn't able to palpate any lymph nodes, and he wasn't reporting any tenderness as I was palpating his lymph nodes. Okay, so moving on, the next thing we're going to be doing is I'm going to be inspecting your back. So I'm going to have you stand up and move your chair. I'm going to have you sit facing the window here so I can look at your back. Turn that for me. Okay. So first, just inspecting the shape of the back. Can you turn it a little bit more? And inspecting the shape of the back looks symmetrical on both sides. There's no deformities that are present as I am inspecting the posterior chest here. So next I'm just going to be palpating in the lung fields, and let me know if there's any tenderness as I palpate. So upon percussion of the chest, I'm hearing resonance throughout the chest. There's no areas of dullness or hyperresonance in the lung fields. So next I'm going to be auscultating your lungs using diaphragm. I'm just going to have you take nice slow deep breaths in as I place the stethoscope. So I'm not auscultating any adventitious breath sounds. The breath sounds are clear and there's no crackles or wheezing in any of the lung fields. So now I'm gonna have you turn back this way. And I'm going to get you a glass of water and I'm gonna stand behind you and palpate your thyroid as you take a sip of that water. So as he's sipping the water, there's symmetrical rise and fall of the thyroid gland tissue. So now I'm going to be inspecting your anterior chest. You can actually go ahead and lay down for this one. So if it's okay, I'm going to pull down the gown here to expose your chest and your abdomen. So just first inspecting the chest. The skin color again is appropriate for ethnicity. There's no signs of a barrel chest, and each side is symmetrical with one another. So now I'm going to be looking at your jugular veins on both sides here. Okay. Looking at the internal and external jugular veins on both sides, I see a supine. I'm not noting any jugular vein distension on either side. So now I'm going to be auscultating the carotid arteries with the bell of the stethoscope. Okay, and there's no sounds of a bruit in the carotid arteries, so now I'm okay to palpate the carotid arteries. Good. And this way. Carotid arteries are about a +2. There's no thrill that's present either. Next I'm going to be palpating your brachial arteries. Again, these are a 2+ pulse, and then I'm going to be palpating your radial arteries. Good, these are also 2+ pulse as well. So now I'm going to be inspecting the precordium area. I'm not noting any lifts or heaves of the chest. So now I'm going to be auscultating. We're just going to be listening with my diaphragm in all 5 of my spots, and then I'll be listening with the bell. So I'm going to be listening in the aortic, pulmonic, Erb's point, the tricuspid, and then the mitral areas. So I'm hearing S1 and S2 sounds. I'm not hearing any extra heart sounds or any murmurs either. So next we're going to move on to inspecting the abdomen. So just first inspecting the abdomen for shape. The abdomen is flat and symmetrical. And there's no hernias that are bulging as he is taking deep breaths in and out. So now I'm going to be auscultating, first listening the 4 quadrants for vowel sounds, then I will be auscultating the abdominal arteries. First, going to listen for vowel sounds. Great, so vowel sounds are present in all 4 quadrants and they are normal active. So now I'm going to be listening in the abdominal arteries. So first going to be listening to the aorta. This is going to be a few centimeters below the xiphoid process here. And then I'll be listening to the renal arteries, which is going to be about 2 centimeters below where I'm listening from the aorta and laterally. And then listening to the iliac arteries. These are going to be a little bit below the umbilicus and laterally. And then the femoral arteries, I will be locating the pubic symphysis, and then the anterior iliac crest and going right in the middle of those. I'm listening with the bell of my stethoscope. I'm not hearing any bruits in any of the abdominal arteries, and they're about a 2+ sounding pulse. So now I'm going to be percussing your abdomen. So let me know if there's any tenderness as I percuss. Good. I'm hearing tympanic sounds as I am percussing the abdomen. A little bit of dullness up here in the right upper quadrant, which I expect to find percussing over the liver edge, but otherwise tympanic throughout. Now I'm going to be palpating your abdomen, first with light palpation, then with deep palpation. So again, let me know if there's any tenderness. Any pain?
No.
Good. Now I'm going to do deep palpation. Good. No tenderness with light or deep palpation is noted, and the patient is not guarding, and there's no rigidity that's felt. So now I'm going to be palpating your liver. So I'm just going to place my hand behind you. I'm going to have you relax. Okay. So I'm feeling in this mid-clavicular line right under this costal margin here. Okay, I'm going to have you take a deep breath in and out. Good. I'm feeling the liver margin about 2 centimeters below this right costal margin here, the liver edge. Okay, and then I'm going to be palpating for your spleen. You can relax your back here. This is going to be under the left costal margin here. Typically, you're not going to be able to feel this. And I'm not able to palpate the splenic tip here. Can you take a deep breath in and out? I cannot palpate the splenic tip, but that is only in 5% of people you're able to feel the splenic tip there. Okay, so the abdomen is complete. Now I can have you go ahead and turn back over here and have your legs angled and sit. And turn this way. So I'm going to be inspecting the legs, looking at the color, looking for any varicosities or any swelling. There's no swelling or varicose veins that are present that I am inspecting on the legs here. The skin color is appropriate. There's no redness or discoloration of the legs. So now I'm going to be palpating your calves. Let me know if there's any tenderness. Any tenderness there?
No.
Good. Any tenderness?
No.
Good. If the patient was having calf tenderness and if it was unilateral, that could be signs of a DVT, or there could be pain with cellulitis as well, but those findings are not present. So now I'm going to be palpating for any pitting edema in the legs. Good. No pitting edema is present in the right leg. And there's no pitting edema in the left leg. If edema was present, that could possibly mean failure of the heart or the kidneys or the liver, venous insufficiency with pooling of the fluid within the legs. So we would definitely want to investigate that further. So now I'm going to be palpating the posterior tibialis and dorsalis pedis pulses. So the posterior tibialis pulse is going to be right behind the medial malleolus. Great, this is a 2+ pulse here. And then the dorsalis pedis is going to be on the dorsum of the foot along the greater extensor tendon. Good, this is also a 2+ pulse. And a 2+ pulse is felt there. So now I'm going to do range of motion of your legs. So I'm first gonna do your knees while you're sitting up like this. So I'm gonna have you straighten your leg out and then bend it back. Again, straighten, go up. This is extension, go down, this is flexion. And then go ahead and push into my hand, good, and push down, good. Again with this leg, extend up and flex down, and then extend up again in my hand, good, flex down in my hand, good. So in the knees, there's full range of motion and strength. Strength is 5 out of 5s. For the ankles here, I'm gonna have you dorsiflex up, plantar flex down, dorsiflex up, and plantar flex down, good. And then go ahead and just raise your feet up, and then push them down, good. So in the ankles, there is full range of motion and 5 out of 5 strengths as well. I'm gonna have you lay, if you can, maybe just back this way. And we're gonna be looking at hip range of motion here. So I'm gonna kind of help you here. We're gonna do hip flexion and hip extension, and then hip adduction, abduction, adduction. And then go ahead and bend a little bit. We're gonna do internal rotation and external rotation. Good. I'm gonna come on this side and do this leg. So hip flexion and extension, abduction and adduction. Go ahead and bend. We're gonna do internal rotation and external rotation. Great. So there's full range of motion in the hips there. And you can go ahead and sit back up. So now I'm going to be inspecting the fingers, wrists, all the way up to your shoulders here. Looking for any nodules or any tenderness, deformities here. Not noting in the fingers or in the wrists. I'm palpating the olecranon for any olecranon bursitis. Get on this end. Not feeling any nodules or any cysts. No swelling is present. There's no pain. And there's no olecranon bursitis in the elbows here. And then I'm going to be doing shoulder range of motion here. So I'm going to have you go ahead and lift your arms up, straight forward and up, reflection, and then extension will come behind you, good. And then abduction is out, abduction is out, adduction is back together. And then for external rotation, good. And kind of bring it behind your head, good. And then internal rotation, kind of touch your scapula of your back, great. Was there any pain with movement? Good. So there's full range of motion in the shoulders. Next, we're going to be looking at your elbows. So I'm going to have you flex up and extend out, good. And then again, go ahead and do like a bicep curl up into my hands and then push down, good. So full range of motion is present in the elbows and strengths are 5 out of 5s. We're going to do the wrists down. Go ahead and flex down and extend. We'll radial deviate and ulnar deviate, good. And then I'm going to have you push up into my hands and then push down, good. So there's full range of motion in the wrists. The strengths are 5 out of 5s. And we're going to check your fingers here. So I'm going to have you flex your fingers, extend your fingers, and then abduct your fingers, and then bring them back together for adduction. Good. And I'm going to have you bring your thumbs in and back out. Great. And then I want you to spread your fingers out, and don't let me bring them back together. Good. Now bring your fingers together, and try and push my fingers out. Great. So there's full range of motion in the fingers and 5 out of 5 strengths in the fingers as well. So now we're going to move on and be testing deep tendon reflexes. So I'm using the reflex hammer here. First testing the brachial reflex. This is going to be C5 and C6. And just relax, close your eyes. Okay. And then on this side. Good. And then I'm going to be testing the triceps. This is going to be C6 and C7. So I'm just going to let your arm then go back here. Again, keeping your eyes closed. Okay. And on this side. Okay, let it dangle. Okay. So, in the brachial and the triceps, there is a 2+ DTR, deep tendon reflex reaction. Now I'm going to do the brachial radialis. Again, close your eyes for me. Okay, and this side. Okay, there's a 2+ reflex reaction on the brachial radialis. Now I'm going to do the patellar. Again, I'm going to close your eyes and maybe pull your hands like this. Okay. And okay. 2+ reaction in the patellar. This is going to be L2, 3, and 4. And then the Achilles reflex, this is going to be S1. Okay. Okay. So there is a 2+ reaction on the Achilles tendons as well. So now I'm going to be assessing neurologically coordination of movement. So I just want you to touch my finger and then touch your nose. We're going to go back and forth a few times. So go ahead and touch my finger, back to your nose, back to my finger, back to your nose, to my finger, to your nose, to my finger, to your nose. Good. There is smooth and coordinated movement going back and forth. There's no jerky movements as he's doing the nose to finger movements. So now I'm going to be testing sensation of your upper and lower extremities. So I have 2 objects here. This is going to be soft or dull, and this is going to be sharp. Okay, I'm gonna have you keep your eyes closed and do it in different spots down your arm and then different spots down your legs. Let me know what you feel on both sides as I do it.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Good. Sensations intact in the upper, he's able to distinguish between sharp and dull senses. Now I'm going to do your legs here. Same thing, dull and sharp.
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp.
Good. So sensation is intact to the lower extremities. He's able to again distinguish between dull and sharp sensations. So now I'm gonna have you stand up. And I'm gonna have you turn this way and come this way, and I'm gonna have you flex forward for me. And I'm just gonna be assessing the spine here. There's no scoliosis that's present, no deformities. Any tenderness as I'm palpating? Good.
No.
So no tenderness upon palpation of the spinal column. I'm gonna have to stand back up. We're gonna go through some spinal range of motion. I'm gonna have you flex forward again. Extend backwards. Good. And then I'm gonna have you kind of lean to the left, lean to the right. Good. And then have you do some rotational movements left and right. Good. So there's full range of motion in the spine, moving in rotation and lateral side to side, flexion and extension. The last thing I'm gonna do is I'm gonna have you walk towards the wall back there and then turn around and walk again towards me. Just assessing his gait. I'm not noting any ataxia with walking, and there is smooth and coordinated walking movements within his gait. Okay, so that concludes the assessment. Thank you for your time. Do you have any questions for me?
No.